All right, hey, my name is Stefan Georgi. I'm here today with Jake Walsh and Diane Costo of BrainCore Therapy of the Low Country. BrainCore's got offices in in Hilton Head, Bluffton area, and then they also have a presence in Boston and around that area. But today we're with Jake, who is a war veteran who had struggled with PTSD for some time before finding out about BrainCore therapy and neurofeedback. And he used, working with Diane, he's had some really remarkable results and sort of a bit of a turnaround. And it's probably what will be best, I think, is if Jake kind of shares a little bit of the story on his own words rather than me. So, Jake, if you want to just kind of introduce yourself, kind of talk about, what your experience so far of using neurofeedback, maybe kind of a little background on your service or anything like that. I think that would be really great.
Sure. I was in the Army for 6.5 years. I was a medic in the Army, but I was in an infantry battalion. It was 520th Battalion. I was very fortunate in that 6.5 years only to deploy once, and that was to Iraq for 15 months. Coming back from all that and trying to reassimilate to civilian life was harder than anticipated. I've been diagnosed with PTSD through the VA. They like to give medications and talk therapy, and usually it's with someone different every time. Maybe that has to do with my relocation. Maybe they've gotten better about it. I don't mean to just talk bad about the VA, but their MO with me was giving me medication after medication, try to keep me numb, and then talking to people, which was painful.
Sure.
And then I began neurofeedback here in Hilton Head, or Bluffton actually, last November. I found out about it through Honor Our Heroes Foundation, which I volunteer with. We were at a larger meeting, which is the Military and Veterans Services Alliance in the area here in Beaufort County. We were at that meeting. Someone knew someone else. Ed actually knew a fellow board member of Honor Our Heroes. They started talking. They were introduced. My fellow board member, Joe Mazzara, was introduced to BrainCore, which then led to me getting into the treatment. And I almost had 40 sessions. I think Thursday, I go again on Thursday, and that'll be 39.
Yeah.
So in the last 6 months, I've done almost 40 sessions. But when I started, I was having trouble sleeping. My anxiety was uncontrolled. There was rumination, depression, definitely withdrawal.
Sure.
I was forgetting things. I couldn't focus. I didn't want to leave the house. Just a lot of symptoms due to the anxiety and everything. But from what the feedback I've gotten from people that have seen me through this process has been that there's been an elimination or at least a decrease in all those symptoms.
That's awesome.
And I don't think 6 months ago I would have done what we're doing right now. So
That's true.
Cool.
Diane likes to laugh about it. She saw how painful it was in the past, but it's getting better. It's for the foundation. So, and we're trying to team up with BrainCore. So, the foundation is trying to team up with BrainCore to try to get more veterans into BrainCore, so that we can treat these symptoms instead of putting a Band-Aid over these symptoms, which the VA has chosen to do for the last 80 years. It's ridiculous.
Absolutely. Well,
Right.
yeah, that's pretty incredible. And obviously it's encouraging. It's really exciting to hear that you've been getting, seeing really significant improvements. And 15 months is a long time. I guess as a civilian, when I think of someone being deployed, I generally think maybe 6 months or something, which is still a long time. But it's like a year and more than a year. That's crazy. And it's really nice that you're starting to see feel better, I guess. Diane, do you want to talk a little bit then about just how BrainCore works, how neurofeedback works, how it is drug-free, how there isn't that use of medication to kind of mask symptoms or to make you numb, but that it's very different from traditional kind of protocol for this sort of thing. Do you want to share a little bit, and also a little bit just about who you are, Diane, and your credentials?
Sure. Diane Costa with BrainCore, the Low Country. I see Jake's face on there, though. But as Stefan said, I also oversee some offices up in the Massachusetts area, in Mansfield and Foxborough. I'm real fortunate to be working with Dr. Guy Annunziata very closely. He's the founder of BrainCore Therapy. BrainCore Therapy is drugless, non-invasive. What we do is we do an initial QEEG. We take a look at brainwave patterns, and there are common patterns that get out of order, basically, go hand in hand with a lot of symptoms. So in an instance, in a case like Jake with the PTSD, we did start with those mapping type of protocols to try to retrain the brain to better regulate itself. Basically, we're exercising the brain in a way that it creates new neural pathways, kind of like learning to ride a bike. You exercise and you practice it 20 times, fall on pretty much, you've got it in there. You might be a little wobbly if you get on 20 years down the road, but you still have that pathway in there. So basically our therapy is doing that same thing. So we're able to retrain the brain, help alleviate some symptoms, and then with PTSD we go into a totally different type of protocol to deal with the deeper issues. But we've had really great results with the combination that we use with BrainCore Therapy.
Cool. That's really interesting. Obviously, people, if they want to learn more about BrainCore Therapy, and you've got two sites. One is BrainCoreOfTheLowCountry.com and also BrainCoreOfGreaterBoston.com, because again, you do have that presence up in Boston and Foxborough and Mansfield. But yeah, I mean, so I guess, and then I guess going back to you, Jake, for a second, what would you maybe tell other maybe veterans or people who are struggling with PTSD, about kind of if maybe they're hearing about neurofeedback for the first time, or maybe they're kind of they don't know much about it. What would you maybe tell them about it? What would you say to someone like that?
I would start by saying that there's nothing to lose and there's nothing to fear. I had some pretty irrational fears to begin with because I wasn't sure. I didn't know Diane very well. The whole situation seemed outlandish and too hopeful, and the setting was uncomfortable for me. So all those things combined told me that I should probably be doing it because it was far outside my comfort zone,
right,
and that I had nothing to lose. So I would tell other people that same everything I just said, and I would encourage veterans to try it because, whatever they've tried or experienced up to that point has got them to where they are, which is looking for an alternative. And this is a functional alternative, and it doesn't rely, like you said, on drugs. There's no surgery. It's not invasive, and it could change someone's life.
Cool.
I have a question for Jake, if he could describe a little bit about the setting when he is in there for the sessions. Is it traumatic? Is it stressful? Do you have to address issues? What's it like compared to other things that you were directed to try?
It's relaxing compared to the other things that I've tried. I've done prolonged exposure talk therapy, which is painful mentally and emotionally, and then almost physically painful because you get so anxious and wound up leading up to it when you have to talk about that stuff. It doesn't require, you're not really emotionally putting yourself out there. You're just having faith in the process, which takes a leap. But it's not requiring you to bridge that gap. It's you guys, the process and yourself meeting halfway. So it's not as big of a sacrifice. You just have to have faith in the process and the science behind it. And again, knowing that if you don't do it, nothing will change. But if you do the therapy, something could change for the better.
All right, great, thank you.
Awesome. Well, I mean, I guess that's it. I really appreciate, Jake, you taking your time to do this with myself and and Diane, you as well. I'm glad we could chat and record this, and hopefully kind of share Jake, your story with others, and hopefully we can help change some more lives and help some more people to just really see some significant improvements and just feel better. And but yeah, I don't know if either of you guys have anything to add, but if not, just thanks again for taking a few moments to do this with me.
No, thank you for having me, and changing
Thank you,
lives
Jake.
is the goal.
Absolutely. All right, guys. Thank you.
Thanks.
Thank you. Bye.
Bye.